All right, today we're going to tackle one of the biggest paradoxes in all psychiatry. We're talking about lithium. It's considered a gold standard treatment, but for some reason, it's often ignored. It's a super simple element with a story that is, well, profoundly complex. You know, I love this metaphor that researchers use. They call lithium a Cinderella drug. Think about it. It's a true, proven lifesaver that often gets left behind while all these newer, shinier treatments get to go to the ball. And that right there sets up our central puzzle for this whole explainer. If this medication is so effective, a gold standard, then why on earth is its use plummeting? To get to the bottom of that, we first have to understand how it even earned that incredible reputation. So let's just establish the baseline here. What is it that makes lithium so special? Well, its power really comes down to its simplicity and the fact that it's been proven to work in so many ways for more than half a century. I mean, just look at this. We are literally talking about the third element on the periodic table. This isn't some complex designer molecule that was cooked up in a lab last year. It's a basic building block of the universe. Just a simple salt that's actually been used in psychiatry going all the way back to the 19th century. This slide really breaks down lithium's power. It's kind of like a triple threat. First, it's great at treating acute mania, but honestly, its true claim to fame is number 2, preventing that devastating cycle of future manic and depressive episodes. And then there's that third pillar, which is what truly sets it apart. Lithium has this distinct and really well-documented ability to reduce the risk of suicide. And this isn't just some side effect of making people feel better. The research actually suggests it might work through a completely different pathway, giving it this unique, life-saving property that's just so incredibly valuable when you're treating bipolar disorder. Okay, so the crucial point is, we know that it works, but how? How does this simple little ion manage to pull off such a complex series of effects inside the brain? Well, that's where the story gets even more fascinating. Yep, you heard that right. After decades and decades of dedicated research, there's still no single, simple answer. The exact way it works remains one of psychiatry's great puzzles. It's not like a magic bullet that just hits one specific target. It's more like lithium sets off this whole cascade of effects throughout the brain. I mean, it touches everything from neurotransmitters like serotonin to the fundamental way ions move across cell membranes. It gets involved in these super complex signaling pathways and even boosts factors that protect brain cells. So it's less like a key fitting into a single lock and more like a master regulator, just subtly tuning dozens of processes all at once. So we've established its power, but now let's get back to that paradox. If lithium is this effective, why is it being used less and less? Well, the answer really lies in this high-stakes balancing act that you have to perform to use it safely. And this chart just lays it out in stark terms. In the late 90s, almost a third of doctors' visits for bipolar disorder involved lithium. Then you fast forward less than 2 decades, and that number gets cut by almost half. That is a massive shift in clinical practice. So why the drop? Well, it all comes down to what makes it a pretty tricky drug to manage. First, it has what's called a narrow therapeutic index. It's a real tightrope walk, where the helpful dose is very close to a toxic one. Because of that, second, you need constant vigilance, with regular blood tests to make sure the patient stays in that safe zone. Third, there's this historical stigma. People see it as a serious drug. And finally, let's be real. It's an old generic drug that's competing against newer medications backed by huge marketing budgets. And of course, you can't ignore the side effects. Now, a lot of them are manageable, but they can be pretty significant. Things like nausea, tremor, and weight gain are all pretty common. A really large number of patients experience something called polyuria, basically excessive urination, which can be incredibly disruptive to daily life. And the risk of developing an underactive thyroid, it's 6 times higher than for everybody else. These are real-world challenges for patients. But out of all the potential risks, there's one that really stands out as the number one concern for doctors and patients, especially when they're thinking about long-term treatment, what it might do to the kidneys. So what is the risk exactly? Well, a major analysis found that over the long haul, the risk of developing chronic kidney disease is roughly doubled for patients on lithium. That is a serious consideration that demands constant monitoring. But here's the crucial context that I think often gets missed in this conversation. It's not a choice between risk versus no risk. It's a choice between risk versus a different kind of risk. So with lithium, its risks to the kidneys and thyroid are well known and you can monitor for them. But many of the newer drugs that have replaced it, They carry their own serious long-term baggage. We're talking major metabolic problems like severe weight gain, diabetes, and heart problems. It's an incredibly complex trade-off. So, where does all this leave us? How are we supposed to weigh these incredible benefits against these pretty significant risks? The answer seems to be that lithium isn't for everyone, but for a very specific group of people, it is nothing short of a miracle. And this is absolutely key. Those profound, life-stabilizing effects of lithium, they are not universal. The research is pretty clear that only about 1/3 of patients with bipolar disorder are what doctors call full responders. So the big question is, who is in that magic 1/3? Well, the clinical data gives us a pretty clear picture of the prototypical person who responds well to lithium. They tend to have that classic textbook pattern of very distinct manic episodes and depressive episodes. There's often a family history of the disorder, and they typically don't have other features like psychosis or really rapid cycling between moods. And this, right here, is the bottom line. For the patients who fit this profile, lithium isn't just another option on the menu. For them, it is often an irreplaceable, life-changing, and life-saving medication. There just isn't an effective substitute. Ultimately, the choice to use it is a deeply personal and clinical calculation. It really hinges on weighing the drug's known risks against the sheer severity of the illness itself, and also against the uncertainty that anything else is going to work quite as well. So we end up right back where we started. Lithium really is psychiatry's misunderstood champion. It demands respect, it demands caution, and it demands expertise. And it leaves us with this really critical question about modern medicine. In our big rush for the new and the novel, how do we make sure we don't forget the old champions that, for the right person, can still absolutely win the fight?